If you're dealing with chronic pain and you're looking to get rid of it and get your life back, this video is going to be the most important thing that you could see.
If you're the kind of person that has pain and just pushes through it, but you know that your life would be better if you weren't hurting, this is for you.
Right? Or if you're the kind of person that really wants to stay active as you age and prevent the pain that slows people down, we're glad you're here too.
I'm Dr. David Gullidge.
I'm Dr. Kyle Gullidge. Today is about you ending chronic pain, not relying on drugs or not relying on surgery.
We're going to cover 3 secrets to permanently ending pain. Now, this information has changed so many lives, and if you stick with us for just a few minutes, you'll see the exciting future of pain correction and how to get your health back.
Absolutely. First thing, I want to share a personal story that totally changed my life. My wife works in the medical field as a nurse practitioner. She hurt her low back in the gym several years ago. Now, I'm a chiropractor, right? I'll fix it up in no time. I started working with her that day, and in 3 days she was no better. Day 7, no better still, but the pain was starting to go down her leg and into her foot. We were both starting to get a little worried. So I took x-rays, and at that point, I honestly couldn't see anything wrong. After 3 to 4 weeks, she got an MRI that was inconclusive, and at the time, she actually worked for a neurosurgeon, one of the best around. He evaluated her, looked at her x-rays, her MRIs. He couldn't find the cause of her pain. So she went to this awesome pain management doctor, had 2 rounds of injections in her spine with no help. She went to the best physical therapist we knew for several months, and basically was no better. I still remember her in our living room crying, telling me she was afraid she was going to be like this forever, and this was going to be her life. Well, there was no way I was going to let that happen.
I mean, I still remember both of us looking at those x-rays, and we did not know what was going on. We didn't know what the problem was.
No, it was rough. You felt helpless, but we put our heads together. We got to work. We started studying a lot of advanced topics, honestly, anything and everything we could. Biomechanics, soft tissue pathology, pain neurology. The list went on and on. Something was going on. And after over a year of her hurting and searching, we came across a new science called Spinal Biomechanical Engineering. A science based on a diagnosis of the exact cause of pain, more exacting than anything we had ever seen, and we had a combined 17 years of experience at the time. I was hopeful for her case. She was the first set of x-rays we analyzed with the software system, and honestly, I was shocked. I saw something on her test that I hadn't seen before, that I could never have seen without the technology. It was too subtle to be detected by me, by the neurosurgeon, the pain management doctor, the physical therapist. Without the technology, we had all missed it. But I'm so happy to report that after her almost 2 years of pain and limited activity, once we started to treat the actual diagnosis properly, which you'll see in just a minute in this video, she's doing amazing. We get to be active again as a family, and we're all really, really happy.
That's such an awesome story.
Yeah.
I mean, now when we look at those x-rays, the problem just jumps right out at us. I mean, this has totally changed us. So we really have 2 main goals for this webinar. The first is to show you this scientifically proven method to eliminate pain and recover health. And also give the information that you need to know so you can make the right decisions for you. But before that, real quick intro on how we got here. So this is a picture of myself and Dr. Kyle. Some years ago, we were both competitive powerlifters, and after years of training our bodies and pushing them, they were beat up and hurting.
Yeah.
So we either had to fix our problems or give up the sport that we love.
Yeah.
After I was recommended surgery for my lower back,
I was recommended surgery for my shoulder as well.
we knew we needed to find another way. We both found chiropractic and both avoided surgery and got our lives back.
Yeah.
It was the most transformative time of our lives.
Absolutely.
Now, fast forward, we've been in practice over a decade and have helped thousands of people. My amazing wife, Dr. Sharin, she practices with us as well. Now, she's not with us today, but she's in the office doing amazing work with us.
Absolutely. Once we got into chiropractic, we thought that everyone else was going to do amazing with chiropractic care just like we did. And while most people did, most people responded really well, there were some people that didn't, right? We saw patients that just didn't really respond to much at all, just like my wife. And you know what? We also talked to people that hadn't ever been to a chiropractor because honestly, it didn't make any sense to them. But now, after we've introduced this new technology, things make so much more sense. There's so much clarity, and patient after patient are just doing amazing.
So real quick, let's talk about what spinal biomechanical engineering, or SBE, actually is. It's actually quite simple.
Yeah.
There's a normal design to the spine. All the bones should be positioned properly and fit together exactly right.
Right, but see, up until this point, there has not been a technology that was sensitive enough to show exactly, down to the millimeter, what's working well and what isn't. SBE is a science based around a new understanding of the spine and a software system that measures the exact mechanics of it. It's pretty much like a blood test for your spine. And until you can see the exact positioning of the bones, how they're working together, you can't determine the exact cause of pain.
Yeah, it's a lot like before the microscope. No one knew what was actually causing an infection. There were people that didn't even believe in bacteria because they couldn't see it.
Why would they?
Right. This new science of SBE is just as revolutionary as that microscope. It's to diagnosing pain as the microscope was to diagnosing infections. It's just a whole new paradigm.
Absolutely. You know, some people tell us that they're unsure of chiropractic, that they've had a bad experience with it. Well, we totally get that. We totally do. But this is different. SBE is the future of chiropractic and of spine care in general. And the accompanying treatment is unlike anything people have experienced in the past as well.
Absolutely. This is transforming patients' lives. It's also starting to transform healthcare. The full videos are on our website, but these clips are one of a surgeon that refers to us and a patient who's a member of the Kansas City Chiefs, Dustin Colquitt. So this type of care is being not only received well, but it's also being appreciated at the highest levels.
If you look at the diagnostics and you look at some of the images that he was able to kind of capture, not in a nutshell, but in like an actual my body, my spine, my neck, and how it relates to what's going on in my business. And when you have that kind of information and see some of the numbers that are off, I think the biggest difference that I've been able to tell is just in the weight room and when I'm on the field, I feel better. If you feel better, you're going to play better, and I think that's the number one rule.
I first brought my daughter to True Health several months ago, and they applied those films to a software. They put it into a software program, and with that program they were able to specifically determine exactly where she's having difficulty. And truly, when they did the exam and it matched up what they saw radiographically with what was going on with her, that's where she was having pain. And so they were able to apply very focused treatment to those areas, and she's done remarkably well. I would absolutely trust myself, any of my other family members to go there.
Now let's uncover the 3 secrets that you must know if you want to end your pain. So number 1, the true reason pain is so hard to treat.
And it absolutely is.
It is. That's why so much pain ends up becoming chronic. And then number 2, we're going to go over new 21st century technology that uncovers the hidden cause of your pain. And number 3, the dangerous truth about spine pain treatment that no one is talking about.
Yeah.
And when you see the real stats that are out there, you'll see why this information is being hidden from the public.
Absolutely. So let's talk about number 1, the true reason why pain is so hard to treat. And the reality here is that pain is so hard to treat because 99% of treatments focus on the effects and miss the cause. People have been told that their pain is the problem and told to take medicines for it. In reality, though, almost all pain is an effect of the body not working right. It's a mechanical problem.
Totally. People will get a diagnosis like arthritis. They develop a disc problem. Maybe they've been told they have inflammation. But what we always go back to is, why that disc? Why did that disc fail and the one right above it is okay? Or why did that joint get arthritis and the one next to it didn't?
Right. I mean, sometimes patients will be told or they think that they're just getting old. Let's say they have a damaged disc, but right above it, a disc the exact same age looks perfect. It's much more than just aging.
Exactly. So the most important thing to understand here is that the real reason why pain is so hard to treat is because it's actually not being diagnosed properly.
Right.
Now, it's not the fault of other doctors.
No.
They just haven't been exposed to this new science yet. It's like diagnosing a fever, but missing the infection.
Yeah, so let's cover a couple of these patients. This is our first example. This patient had been suffering with back pain for years and had actually already had surgery in her lower spine where she was having a disc problem. Several months after the surgery, she was still in pain. In fact, she had been scheduled for a second surgery because the disc continued to break down after the surgery. So that's not good, not what you want.
Nope, not good. So she couldn't get through her day without intense pain. Playing with her grandchildren was totally out of the question.
Yeah.
And she was left taking way more pain medication than she really wanted to. And she was scared that this was going to be how her life was going to be forever.
Right.
So one of our awesome patients, her friends, said, you should go see True Health. see what we could do. See if they could figure out why this disc was continuing to fail.
Absolutely.
So we look at these x-rays. I mean, you might not look at these all day, but this should be straight up and down, and it's obviously crooked.
Yeah, it's not right.
No, it's not right. But just because it's curved doesn't mean that our discs are doomed.
No, it really doesn't mean that.
No, something was continuing to destroy that disc, and only with that SBE software were we able to see it. And in a minute, you'll see her graph, and you'll see it too. So we specifically use two cases, one that's a very dramatically bad x-ray, and one that looks pretty good on x-ray, at least on the surface. So you'll be able to see some of how this stuff can be missed.
Right, and so this is patient number 2. He had neck pain, numbness in his arms. He'd been to multiple chiropractors, been to physical therapists, an orthopedist. He had this been going on for years. I mean, he got some relief for a while, but it never really lasted. He was frustrated because he was still in pain, obviously. He had spent lots of time and money on therapy, but he still couldn't play with his kids, couldn't exercise. He began to gain weight. But he hadn't given up. He was hoping we'd get help, right?
Yep. So again, step one, what's the real problem? So when we look at his x-rays, it should be straight up and down.
Yep.
And it is. So that looks pretty normal.
Good.
Until you really look at the finer details.
Right.
When you do that, you find out these small things jump out at you, and you'll see the SBE digital version of this in just a second.
Absolutely. Before that, though, let's talk about secret number 2. New technology that uncovers the hidden cause of pain.
So new technology is changing everything. You know, and one thing that's changing dramatically is healthcare.
Yeah.
We've got new tests, new diagnostics, but up until this point, most of the energy was spent on treating pain, not diagnosing it, like you'll see in a second.
Right. This is the most exciting thing we've ever seen in our careers, and we are so happy to bring it. So this is an example of an x-ray of the body from the front. You see the x-ray of the neck, the mid-back, and the lower back. Now, these x-rays are pictures, and what we need to do is convert these pictures into data, meaningful data. And so what this does, in essence, is it creates a blueprint of the spine. Each spine bone is a square part in the front and a tail in the back. The computer compares the position of the front square relative to the back tail to determine any rotation in the bone.
You know, and one thing I wanted to say is that we're showing you a picture of the neck, the mid-back, and the lower back, because the spine is one unit.
You have to look at it that way. You have to. Each one of these boxes is one individual spine bone. The computer program converts this blueprint into this readout. And so what we get is the exact position of every one of the spine bones down to the millimeter. First off, each one of the white up and down lines is 1 millimeter. So we're talking about really small stuff here.
So what you'll notice is the blue lines are all sweeping to the right. That's the appropriate, healthy, normal rotation of the spine bones. They should all be working together, kind of like a team.
Right. Just like your cholesterol and your blood pressure, they have ranges that they should be in. The position of your spine bones should closely match the blue bars.
Now the yellow bars represent the patient's bones. And as you can see, some of those are exactly where they're supposed to be. Others are not where they're supposed to be. So that's going to be a problem.
Yeah.
But again, each one of these white lines is only 1 millimeter. So we're talking about 2, 3, 4 millimeters of rotational distortion. You can't see that with the naked eye until you put it through this computer program and analyze it. It's so important.
Right. And now, even if you could possibly see one, you're definitely not going to see the whole pattern.
Definitely. Okay. So every time you see a yellow bar going one way and it should be going the other way, that joint is under chronic tension.
Absolutely, tons of it.
So those joints, those nerves are not happy. The body simply can't work together like it's supposed to. Those joints are going to wear out, develop pain and arthritis.
Absolutely. So let's show you how this looks in actual cases. Let's go back to patient number 1, suffering with back pain, hoping to avoid surgery. What was her real problem? First off, we image the whole spine, and we obviously see the scoliosis. We see the position of each bone compared to normal. So again, remember, yellow bars represent the position of each bone. C2 at the top, that's a bone. C3, that's a bone. Let's look down at the very bottom, at the L1, 2, 3, and 4. And that's where the patient was having her symptoms, right?
So again, the blue is normal. So what do you see? Do you see that L4 and L5 are actually swinging in the opposite direction of where they're supposed to be? Right? So those are the discs that are breaking down right there.
Right, and actually that opposite rotation at the bottom 2, that's what my wife had as well.
Yeah, that's a big issue in a lot of low back pain. Now, what happens if you look above that area, where you have this massive over-rotation of the bones just above those discs? Well, you know, while they're going the right way, it's important to note that they're going way more than they should be. So that's not a stable spine. Something is going to give here. So what if you just do a patch job down here at L4 and L5 and you still have this huge rotation right above it, torquing that L4 and L5?
Well, I'll tell you what's going to happen. It's going to break down. There's no question. It's only a matter of time. The amount of people that have spines with these types of findings, not necessarily scoliosis, but discs that are just waiting to give out, is so much more than people think. When people say that they threw out their back like picking something up, or that they slept wrong, they have no idea what their spine is actually like mechanically.
So really, you have to balance out the whole spine here to take pressure off that failing disc.
Have to, yeah.
So, and if you don't do that, it's just going to keep failing there.
That's what was happening with her.
So this is our blueprint to work with this patient. We knew exactly what we had to do.
Right. In a second, we'll show you her follow-up study, and it'll show why she might have actually been able to cancel her surgery, right? Now, people always ask, how does the spine lose proper position? Well, we have whole videos covering that exact topic, but the basics are traumas, both large and small. They start when we're very young, and they accumulate over time, and then also bad habits, like sitting too long with bad posture.
So very important to keep that in mind.
Yeah.
Okay, so here's patient number 2. Same thing. We're going to look at the whole spine. This is the one that had pain down his arms, couldn't be active, he was gaining weight. We imaged it, and here you go.
Now, remember, the yellow is the patient, the blue is optimal. I mean, right there. Look at right in the middle, that's C4, C5 swinging way in the wrong direction.
Yeah, it's not good. So those joints aren't right. It's going to irritate the nerves right there. So that's why he was having pain in his arms, because the nerves that go down his arms start in the neck.
Yep.
So even though no one had seen these findings, once you put it through this software and really look at it through this analysis, we can see exactly what's going on and we know how to fix it.
Right, I love it. If you look at the worst spine bone, right there at C4, we're talking about 2.6 millimeters of movement. You simply can't see that with your eye. This is why provider after provider, smart people, are going to miss this, just like in my wife's case. And these patients are left in pain, spending money on stuff that just doesn't get to the cause.
Totally. It can be rough out there.
Yeah.
So, secret number 3, the dangerous truth about spine pain treatment that no one is talking about. So what if we've all been purposely lied to? I mean, how many times have we all seen ads that just say, if you have these symptoms, take this medicine. Right. So that's how we've almost all been programmed. But if you look at the results of it, it's not pretty.
Right. Here's the FDA saying non-steroidal anti-inflammatories. It's ibuprofen, Aleve, Motrin, Excedrin. The things that are taken over the counter when somebody hurts, they lead to heart attack or stroke. Here's the Journal of Neurology. Popping Motrin could ensure you die rather than survive a stroke.
Good. Here's the CDC, a very conservative organization, saying that prescription medication bringing $17.8 billion annually. That's drug costs for pain every year, and that's why we say this. It's a little aggressive, but when we say you've purposely been lied to, but we all know in any industry you can follow the money.
Out of 690 million patient visits for pain, 99% received a medication, 29% reported taking 5 or more. It's a huge industry that wants people on drugs.
This is really wild. Each year, more than 100,000 patients are hospitalized for stomach bleeding from these over-the-counter anti-inflammatories,
Yeah.
and 16,000 people a year die. So that's no small thing.
No, it's not at all. Here's a paper showing when you take anti-inflammatory medication, it actually accelerates the degeneration of cartilage.
So you're degenerating your joints more when you take that stuff?
Yeah, that's exactly right.
Means you'll probably need more in the future.
Yep.
So keep you comfortable now, but your joints are going to keep deteriorating.
Yeah, that's the thing, right? And now if all you're doing is just kind of kicking the can until you're ready for a hip replacement or a knee replacement, that's one thing, right? But you can't do that with the spine.
No, there's no spine replacement.
No, there's not. So here's an article showing people that used anti-inflammatories for pain have increased risk of dementia and Alzheimer's. That's one of the scariest things for people these days. It really is.
Yeah, no kidding. So if you don't know the cause of something, and you're just using chemicals, medications to treat the effects, you're going to increase your risk for stomach bleeding,
Yes.
Alzheimer's,
Yep.
cardiovascular problems, and degenerating joints.
But all at the same time not understanding that pain is an effect of something else, right? Now we've all heard of the opiate crisis, but the thing to understand is that this is a natural consequence of not understanding the cause of the problem.
Okay, this is a crazy one. So chronic back pain is associated with a shrinking brain. So if you look at the tip of your finger, halfway up your nail, that's about 1.3 cubic centimeters. That's the amount of brain matter you lose every year you're in chronic pain. Year 1, year 2, year 3. Some people are in pain for years on end. What's that doing to the brain?
It's so much worse than people know. You don't just push through pain. It's having an effect on your body.
Yeah, no one wants to have a degenerating brain, but that's exactly what's happening when you're in chronic pain, and no one is talking about it.
It's crazy.
Yeah, it's
Yeah, it really is. It absolutely is. So they said that people that were in chronic pain, the brain volume looked as if it were 10 to 20 years older than people of the exact same age because of what pain had actually done to the brain.
And here's the craziest part. If you take pain medications just to block that, that doesn't stop this brain shrinking process.
That's crazy.
Yeah. So that's an amazing thing. So what do you have to do? You actually have to find and fix the cause, not just medicate it.
Wow.
Yeah. So there's a better way for everything.
Yep.
Find it. That's what Thomas Edison said,
Smart
and
guy.
that's what this whole thing is about. There's a better way, not just to treat pain, but to fix it.
Absolutely there is.
Okay, so let's look at advanced spinal correction, actually fixing the cause of pain, not just medicating it. We have a video here to show you. It's basic, but it explains how we fix what's wrong with the spine and how we work on patients here in the clinic.
Yeah.
Okay, so now we're going to talk about how to actually fix this. So this is an example of one of the SBE graphs that we've blown up, and we're actually going to lay it on top of the patient so we can see, get a better understanding of what this is actually showing. So for example, this is the L5 bone, and each one of these again represents 1 millimeter. So the L5 bone is 5 millimeters over this way. This is just much more dramatic so you can see it. As we overlay the spine on top of this, each one of these bars represents the relative position of each one of these. So for example, this area through here, these bones are over-rotated dramatically. So we're to take this adjusting instrument, contact these bones, and then slowly over time reposition them.
Now, obviously there's a lot more complexity to it, but if you understand the video you just watched, you get the basics.
So then there's rehabilitation. That's a big part in how we fix the spine. We both have training in exercise physiology and rehab, but it has to be specific. Even if two people have the same problem, like low back pain, there's no one magic exercise or magic stretch. It has to be in consideration with how the spine is dysfunctioning.
Absolutely. Say, for example, you have this spine, and then you have this spine. If you stretch the same muscles and strengthen the same muscles in these spines, you're going to have problems because you don't have the same thing going on. They're different things.
Totally. And the SBE analysis allows us to see what needs to be done.
Right. Another thing we're big on is dry needle acupuncture. It's a great way to bring blood flow into areas that aren't healing like they're supposed to. Right?
Yeah, well, but again, you have to know what tissues that need the work, right? Just because it hurts doesn't mean you should use a technique, or just because it's tight doesn't mean it needs to be stretched or massaged.
Right, that's
we
huge.
have to understand that there's a cause for these things and fix it.
That's so important. Those are the three main ways we found over the last decade to predictably fix a spine. Specific adjusting, strengthening and stretching, as well as acupuncture, all based on the SBE diagnosis.
Now, going back to those two cases, we apply these principles, and now let's show you what happened. So, remember this case, the woman with a bad low back who was determined to avoid her second surgery? Let's look at her 10 weeks into care.
Yeah.
Her low back pain down 90%, numbness in her leg gone. She was able to start exercising again with very little pain.
Love it. This is her analysis before, and this is her 10-week follow-up. Is there as much torque on the L4-5 discs and bones? Absolutely not. If we look at the L1, L2, those look so much better as well. And it's so exciting to see these pre and post changes. And one of the coolest things for this patient,
Canceled her surgery.
oh yeah,
Love it.
cancel her surgery. Is she perfect? No. It's going to take her longer to get her spine as good as it can be, but she is on the right path.
All right, so patient number 2, let's follow up on this one. Remember, he had the numbness going down his arms. He had stopped his exercise. After 10 weeks of care, remember before we had those mid-cervicals swinging in the wrong direction? Let's look at the follow-up. The neck is much better. The middle of the back is much better. The whole spine looks healthier and more stable. And his pain, 80% improved. He could start exercising again.
I love it.
Yeah, it's a great thing.
Totally. And so some people might believe in chiropractic care or they might not believe in chiropractic care. It really isn't about belief at all. It's about the spine. It's about what's actually going on and the best way to fix it. Like most good sciences, it comes down to numbers.
Well, when I was able to see the results that came from the system after the x-rays and everything else, it was meaningful to me because paired with your knowledge and with the system results, I could really truly see what something that I didn't know about before actually looks like.
So it's actually looking at the spine, and then it takes that image and interprets it in what I consider 3D, and then graphs it so that I can understand what's being described. You get a real visual understanding of what's going on, and the doctors get a prescription for what needs to happen.
Right.
And I think it's really cool. It's the best I've seen in 12 years.
So then let me ask you a question. If you're dealing with pain or struggling in some way, the question is, could this really work for you? But think about it in this way. If you understand that pain is simply an effect of something, and you actually found the cause using SBE,
And if you actually treated what's wrong, what would happen? do you think that you could actually improve what's wrong in your body and feel good again?
Absolutely. I mean, you can be active and exercise again. It's happening all the time with patients in our clinic. I mean, and it's every day. It really is.
And getting off some of those medications that we talked about and reduce the risk of those nasty side effects. I mean, even if you have advanced arthritis, especially if you have advanced arthritis,
Yeah.
those millimeters that we discussed in your spine matter so much.
I mean, they 100% do. So hopefully by now you're seeing how exciting this stuff really is. So can you imagine when this becomes standard practice? I mean, this really is just a whole new time.
So while all of this is awesome information, information alone doesn't transform anybody.
No.
It takes action.
Right, it really does. There's no doubt on that, but really the question is, what is the right action? Things can be really confusing with all the different therapies out there. So what we want to do is cut through the confusion and make the right action and the next step really easy and very obvious to take.
Yes, we want to help people take the next step with SBE. So we created an easy way for people watching this video to do just that. Now, I'm sure you're wondering what your spine looks like. Could one of your vertebrae be causing problems?
Right, or even about to cause problems.
Totally. I mean, what's hidden in there that's been missed without this technology? So we created an SBE Analysis Package that covers everything needed to find out what's going on.
Right, so what we do in this is we start with a consultation in our office. You come in and sit down with one of us, and we discuss your goals and your history, and we use our years of experience to make sure that you're a right fit for our office and that we're a right fit for you. So then we have an exam. It's the most detailed exam you'll have.
Yeah, we hear that all the time.
Yeah.
It's a neurologic exam, an orthopedic exam. We check the muscles, we check the spine, the extremities. We look at the body with a very detailed eye. Then we take x-rays.
SBE specific x-rays.
Right. Full spine digital x-rays that we have here in our office. We've invested in the best technology out there so we get the best images, exactly what you need to really get the detail of your spine down to the millimeter.
Right.
So we analyze that with the SBE software.
And then so after that, there's a follow-up report where you come back to the office and we explain exactly what we found. So the exam itself is $120. The specific x-rays are $230, and then analyzing the x-rays with the software system is $200. And that includes the follow-up visit where we explain all of your findings to you.
So the total on this is $550. Now, is it worth $550? Of course.
I mean, an MRI alone is often $1,200, and this is like so much more detailed. You're never going to get this kind of information really anywhere.
But when we were making this presentation, we really had two choices. Choice number one was to leave those entrance fees exactly where they are, because we know that that's worth it.
Yeah.
But choice number two was to lower those fees and make this SBE analysis package the next obvious step for everybody that watches this webinar.
Absolutely, yeah.
We chose option number two.
Right, I mean, honestly, we had to. It's so important. I mean, everyone needs this. Everyone does.
Yeah, so we do the whole thing. The consultation, the examination, the x-rays, the SBE analysis of the x-rays, the follow-up visit we do not for $550, but for only $97 for people watching this webinar.
Right. I mean, obviously that's a no-brainer, but this is still a new thing for some people, and we want to be sensitive to that. So the deal is that we're so confident that when you go through this exam and you see your findings, if you're not thoroughly impressed and you don't think this is for you, then you just tell us and we'll give you your $97 back. There's no questions asked. We are super confident in this approach. We believe that everyone should have these tests done. There's absolutely no doubt to that, but anyone with pain needs to have it done.
For sure. Because we know what happens if a problem is ignored. It always gets worse.
Yeah.
The longer it's there, it becomes harder and more expensive to treat.
Yeah.
Finding out where things are right now is vital so things don't get any worse.
Absolutely. We had two choices, and now you have two choices. This video from the Canadian Heart Association is going to expand on that.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? or get old with disease. It's time to decide. The average Canadian will spend their last 10 years in sickness.
Okay, so now you guys have two choices. The first option, do nothing. Don't take that leap of faith. The second option is to set up a time to come in here, meet with us, see what we're doing, see if it's right for you.
It's no risk. It's all 100% money back guaranteed. So you basically really have nothing to lose except the pain and the limitations to your best lifestyle.
Absolutely. So now, your next step is to register below. Enter your name, phone number, your email, pay that $97 to reserve your spot. Then our staff will be in touch with you at their first available time to get your SBE analysis scheduled. And you'll see for yourself the future of spine care.